And like you described before, shame threatens our connection with others. So, okay, I've got this part that others seem, the majority don't have or might reject, so I'll lock that away. And then we end up with all of these parts of us locked away that we can't show people in case we're exiled. And that's in our nervous system.
Yeah.
And then the amount of effort those protectors have to go to on a daily basis to keep all of that locked up and keep outwardly functioning in an unsupportive society.
It's a lot.
Exhausting.
It's a lot. And makes you think of grief, which is common when you contact parts of yourself that have been locked away. That can be quite shocking, I think, for clients in the room. I think about it as a kind of self-betrayal and self-abandonment.
Our guest today is Matthew Austin. Matthew is a Melbourne-based LGBTQIA plus counsellor and social worker with over a decade of experience supporting clients to overcome self-critical thoughts and cultivate compassion, calm and clarity. As a queer man, his lived and professional experiences with shame have shaped his commitment to helping others access their self-worth. He's held senior roles at leading organisations such as Thorn Harbour Health and Queerspace and has a deep understanding of the external challenges that impact LGBTQIA plus individuals' sense of self. You're listening to The Right Therapist, where we demystify therapy. We'd like to begin by acknowledging the traditional custodians of the land on which we live and work. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples listening today.
Thank you, Laura. It's very generous of you.
What do you love about being a therapist?
I think it's a pretty unique job, right? Like to be able to sit with people and hear their stories and hopefully be able to offer something to help. And I'm learning with clients. You see when something works and it fits, the kind of fairly quick transformation that can make. That is very satisfying. Like it brings a lot of meaning to my life when that happens. Yeah.
Yeah, I think it's a unique part of the job, the satisfaction you can have from even sometimes in a session, someone arriving quite dysregulated or just not okay in whatever way and leaving feeling like much more grounded and capable and okay.
Yeah.
Yeah. Or obviously the same thing over a longer span of time.
Yeah, that is. And a lot of it is obviously is about people sharing their stories, often that they've never talked about before. And that in and of itself seems like it's quite a big relief.
That's an interesting point around shame as well.
Yeah.
Can you say a bit about what it means to share a story like that?
A shame-based story?
Yeah. I think generally something that people haven't ever shared before is almost definitely going to be shame-based, right?
Yes, that's true. Like secrecy and shame are like two little cousins. Well, I think for everyone, you're nervous, right? Like it's a big thing to talk about. Usually it's kind of sat there in the system in some way for a long time often. But often, I don't know that everyone knows what a shame-based story is or knows what it feels like.
What does it feel like?
Well, I guess like how shame feels in the body, right, is a little bit unique for everyone, but often it's like a sense of sinking in the stomach, like you want to disappear. And so some of the work is helping clients identify those experiences as shame-based, so giving them that language, and that can be helpful, even just being able to label it as that. There was this, when I was a children's therapist, there was a particularly well set up play therapy room, and it had this laminated poster, and it said on it, "Name feelings to tame them." So I often think of that with clients, that a lot of the work is naming what you're feeling. And obviously it doesn't make it go away, but that in and of itself can help. Yeah.
I remember my first real introduction to the idea of shame was in my psychotherapy studies.
Mm-hmm.
And the facilitator started talking about shame, and we were invited to kind of locate our own shame. And I was like, haven't got any. No, like, I'm good, you know. And I think I knew what embarrassment was, but I wasn't someone who got embarrassed a whole lot. And I thought they were sort of the same thing.
Mm.
But of course, it wasn't until we dove really deeply into shame that I started to be able to even locate it in myself. I had no concept that I had shame. And now when I think of it, I feel like it was like boxed right up,
Mm.
lurking in the depths, hopefully never to be seen again. I think that was my strategy for it. And I think it's a case for a lot of people. But I just didn't even know what it was. It was so unfamiliar to me to actually name it or look at it.
Yeah. I was just thinking Brené Brown's TED Talk was very helpful for that for me. And that was, when was TED Talk a big thing? Like 2010?
Yeah, something like that.
Yeah. And I kind of devoured everything that she was writing and speaking about. And she speaks about the difference between embarrassment and shame in this very eloquent, easy to access way, because they do get confused, right? Like,
What does she say about it?
well, she says that embarrassment is like a fleeting feeling about something that we've done that's a bit embarrassing. Like you fall over, right? You get a red face and hopefully you laugh about it and then you move on with your day. But shame is, so I guess the difference between guilt and shame would be guilt being I did something bad and shame being I am bad. Because guilt and shame often get confused too, along with embarrassment. But shame is a more global assessment of self.
So like the embarrassment or guilt is like situational, like something that we've done.
Mm.
And the shame is more like a whole belief about who we are.
Right. Yeah. And I remember that one of her TED Talks, she talked about the stats around the difference between someone having a lot of guilt or, a healthy amount of guilt versus someone who has a lot of shame. She spoke about if you have a lot of shame that hasn't been processed or identified, you're more likely to suffer from addictions, mental health problems, a whole range of kind of negative health outcomes. Whereas if you have a sense of healthy amount of guilt, it works inverse because you can take responsibility, right, for your behaviors, and because we're all messing up all the time, but not to be taken on personally and just be, I did something bad. I know how I can address that with that person and not spiral into shame.
It makes me wonder about the therapist's shame and how we can miss shame and avoid shame in therapy.
Right. Yeah, that's right. And I don't know that, was that a big part of our training?
Yeah, I think, there was a fair chunk about shame sensitive practice and that we need to examine our own shame in order to even be able to see it in other people, because we're so accustomed as a self-protective measure, so accustomed to avoiding our own shame and avoiding other people's shame. It's not something anybody, our systems protect us by not letting us see or feel shame in ourselves and others. So as therapists, I feel like a huge task is to really know our own shame so that we can see it in a client and help them come to it as well.
Yes. Yeah. And I guess you would know also as a therapist that there's times when there's something that presents in the therapy room and it catches you off guard and you realize it's a shame-based thing you haven't worked through. And because shame is such a powerful feeling, can be a bit unraveling sometimes in the moment because it's so strong and you don't often have language for it in the moment. But yes, I think, you have to be able to, what are they saying? It's like you can only take people places you've been or something adjacent to that.
I can only kind of go as deep as you've gone yourself.
Right.
You only take
Your own
clients.
process.
Yeah.
And it's really interesting. I think clients and people intuitively sense that. If you haven't, as a therapist, worked through enough of your own shame, say about sex or whatever, like is a really shame-prone thing, clients sense that in therapists. I think that happens really unconsciously, and then that safety isn't there, so it won't come up.
Yeah. It makes me think of that idea that, and this is why it's so important that therapists do their own therapy.
Right.
I just think I don't know how I could have been a therapist if I hadn't done my own therapy, because if I can't hold my own shame, for example, the client's nervous system knows that, and it's not going to let their shame come anywhere near the surface in a session with me, or their woundedness.
Yeah, that's a whole other topic, isn't it? Like, because that's not part of every therapist's training. Yeah.
I think it's one of the real advantages of psychotherapy, the requirement of therapy. And I think a way that all therapies could be improved is, and something that I would always recommend is that people find a therapist who has done their own therapy, and you can ask them. And it's such a huge investment that clients are asked to make, not only financially, which is also, obviously a big investment, but their time, the time they take to make the appointment, to find the therapist, to make the appointment and come and see the therapist, but the emotional investment of so many clients I talk to, you say, I'm just sick of going in and telling my life story and then feeling like this isn't the therapist for me, and then I have to start all over again. It's exhausting emotionally.
Yes.
Yeah.
Actually, that makes me think some of the consistent feedback I get from clients who've seen therapists before is they're too passive. Like I'm hearing that over and over and over again.
Yeah, so it sounds like they're looking for someone who's stepping into the space with them.
And collaborate, right? Like, how are we going to work towards your goals together? Like, what does that look like? So ideally, the therapist can adapt at least somewhat and be flexible based on what the client needs. I don't think we're taught that really very much at school. But if you can find someone that's able to do that for you, kind of meet you where you're at, and you feel engaged in the process, the goal setting, you feel like you know what you need to do between appointments, all of that was more and more important.
I feel like a lot of people maybe don't go to therapy because they wonder how talking to someone could possibly help. And I think when they're wondering that, I think they're imagining that the therapist sits there very passive and just listens or just affirms even. That's not what you're describing that therapy is with you.
No, there's a bit of that. And I kind of feel like it's lazy, to be honest. Like, because you could, right? Like you could, based on our training and other trainings I've had, you could legitimately sit there and not do very much and take people's money and call it therapy. And some people really need that, but you need to be like really explicit with people. Like, what do you need? Do you really need me to be like a very open listener and kind of let you tell your story and kind of sit back?
So that could be what somebody is coming for.
Right.
But you would name that and check them. Is that what you're here to do?
That's right. Like try and get on the same page about that. Because I think what you're saying is people, and I've had this experience as a client, like you go and there isn't much direction. It's like just talk. And then that's where like therapeutic drift happens. And you like, why am I going again? Like, your
What's
goal.
therapeutic drift?
Well, therapeutic drift would be like, so that's when there isn't really a treatment plan, or there is, but you've moved really, really far away from it and you're not sure what you're treating anymore. The client keeps coming because maybe they like you and it's nice to talk with you, but the goals have gotten really loose, or there's not much focus or intention about why you're both there.
And the client doesn't necessarily know how it's supposed to go, right?
No.
So the client could keep coming for a year and just talking and be thinking, okay, well, I guess this is what it's supposed to be. I guess this is what the therapist is doing. So
Yeah, that's
this
right.
is what we're doing.
Yeah. And then I imagine you, over time, if that keeps happening, you get cynical about therapy and will give up. Like, you're like, well, I've tried. And lots of people
Think
have.
about how much money you've paid over the course of a year and wonder what you got for it.
You can't. That's one of the reasons I use outcome scales, is because it's a visual reminder of what we're doing and if the client is improving or not. And so there is something tangible for the client.
Yeah, so it's explicit and clear,
right?
What we're doing, where we're going with it, what we're noticing, where we are on the journey towards where we want to be. And that the therapist and client are both active participants in the session. And I really name constantly kind of coming back to, something will emerge in the therapy and I'll name, this is what we're talking about, or this is what you mentioned in our first session of where we want to go with this, and we can track how far we've come along that
with
journey.
That particular topic.
Yeah. It shouldn't be a mystery to the client how they're going.
You would hope not, but like sometimes it is.
Yeah.
Like, and then it's also this, I imagine it's sometimes like, well, I'm doing something, like I'm going, but that in my experience isn't enough for people to see the change hopefully they want to see. So how do you elicit someone's motivation? How do you engage them in the process?
What should a client do if they feel like they're in a therapeutic relationship where they feel like nothing's happening?
I would suggest they talk with their therapist first about it. And maybe like you said, have some things written down that they can refer back to. Kind of more and more, I'm trying to encourage clients to bring notebooks and see how the therapist responds. If you get a bit of a defensive response, that's not a great sign. Ideally, your therapist can take on feedback and adapt. And it's not to say that every therapist is it's not going to be the right fit for you. Sometimes it might be an ending or closing session, that discussion. But first of all, it's a great skill development to tell someone in general, I'm not happy, this isn't really meeting my needs, I didn't feel heard or understood. I don't understand why we're talking about this topic, why we're talking about my childhood again. I don't understand how this is relevant to my relationship now, etc. To talk with them, see how they respond.
Yeah, and ideally the therapist would respond by really hearing the client out and asking more questions about what it is that they need, what it is that they're noticing isn't working. And as you say, if you're finding the therapist gets defensive, or if you feel like their body's seizing up and they're getting a bit offended, I'd say that's a bit of we're human. That might happen for a moment. I don't know. But I'd say it's a bit of a red flag.
It is if you can't own it in the moment, right? So if you were seeing me and you're giving me feedback and I said something a bit defensive and then couldn't notice that and own it and then redirect it back to you, that's, I think, the problem.
Well, if the therapist could own it, would that be something like, oh, I notice I am feeling a bit defensive because I want to be a really good therapist for you.
Right.
Like something like that.
Yeah.
Yeah.
Yeah. That would be nice to hear.
Yeah.
I imagine for a client. Yeah.
Yeah. Yeah. I feel like even myself as a client, even though I'm a therapist, it would be really hard to have that conversation. And I think so many clients would rather ghost than to actually have that conversation and say, I don't know if this is working for me.
Mm-hmm. Ghosting is a big thing in our community right now.
I mean, people that are dating think they get ghosted, but therapists
Get ghosted too. Yes. I get where it comes from. And, and I think that's interesting talking about shame, right? Like that's kind of part of that, I think. How do you tell someone that you're not interested in a respectful, kind way? And then if you don't feel like you have these skills, there can be shame. And then the shame avoidance kicks in. And so you don't call that person back or book another appointment with that therapist.
The client is kind of anticipating the therapist's shame in that, aren't they? They're sort of, I can't say this.
Oh, like in the in-person
if they were to
feedback.
tell the therapist they were not finding it that helpful.
Yes, it's a relational. Like shame is relational. So I think we know in some level. Well, like you said before, like how much shame someone's worked through or not, how much they can non-defensively talk about their approach and adjusting it.
And there's something about power with the ghosting or that having that conversation as well. I remember asking my therapist about ghosting. It was sort of a supervision kind of question. She's a more senior therapist, and she named that ghosting a therapist happens when there's a power imbalance and there's something the client needs to say but can't. So they just kind of feel like I've just got to exit the relationship. I can't name what's happening here. I'll just go.
And do they mean that there's maybe too much power located with the therapist, maybe not enough with the client, and that creates the imbalance where it's really hard to be transparent and honest?
I think that might even look like the therapist is maybe a really good therapist and the client has benefited a lot and the client's very grateful. So they feel like they then can't name something that they're struggling with. Maybe the therapist really missed them in a session, or maybe maybe there was a rupture and the therapist didn't realise the client can't name it because they don't want to be complaining, or they don't want to be ungrateful, or they don't want to shame the therapist. Yeah, I think there's shame and power in that.
Yeah. Well, that definitely comes into it. I think particularly for queer folk, like who are maybe seeing therapists who aren't queer themselves, there's a lot of people come to see me because they're sick of educating therapists about queer-related stuff. So if you're going to see queer clients, you need to be across a few things, like about, I'm not talking about like queer theory per se, I'm talking about like things that happen in our current lives. That's a power thing, right? If you're a therapist and you feel like you can ask a client to educate you about their lived experience, about a specific thing, like about particular identity, that's a power play because they're paying money then to educate you about, I don't know, open relationships or like beat sex or, whatever.
Yeah, you're using the time that you've paid for to teach the therapist about the thing that you want to talk about so they can help you with it.
Yeah.
Yeah. This is a generalisation. If you were going to generalise, would you recommend that queer clients seek a queer therapist?
Yes. I don't think it has to be someone with lived experience, but if that's really important to you, right? Like you've had a few experiences where you've done that, like you've had to educate a therapist, or you felt like they didn't get it, or you felt judged in some way, or then that shut down how open you could be about what's actually happening in your life, then yes, maybe try. But that's not to say you're going to see a queer therapist who's good or who's worked through enough of their own shame, or I guess you would at least want to know that they're queer friendly, right? And I mean more than just putting a rainbow badge on your website. And that's okay to ask too. Like if they don't have lived experience, like, well, who have you worked with? Like, have you been in paid positions where you've worked with queer clients, queer families? And
Yeah, what additional training have you done around
right.
queer
Yeah, true.
issues and therapy?
Yeah. And not just like you did a 1 hour webinar on pronouns. Like that's not going to cut it. Yeah.
I think a lot of therapists, I would even say the majority of therapists would consider themselves allies and might be happy to name themselves queer friendly, but that doesn't necessarily mean they've got any lived experience or any actual training.
Yeah, that's interesting. I would say that maybe this is a controversial thing to say, but if you are allied, you'd want to have worked through your own internalized homophobia, transphobia, and your own sexuality enough to be there for queer clients. So I guess, and that relates to shame, I think, because say, for instance, and I've seen straight male therapists, if they haven't worked through enough of their own gender identity or sexuality, I'll pick up on that. And that's a safety thing for me as a gay man, like with straight men. Like I won't be able to open up like I need to. Yeah.
Is there something in particular that you notice in working with a straight therapist? Is there something that would indicate to you that they haven't worked through their own identity or sexuality?
Or if they like pat you on the back or say, like use terms like bro or this, I guess, really just masculine language. I guess it kind of creates like a distancing because there can be intimacy between two men, hopefully, that's non-sexual. Like, and I think that's something that that's not nurtured, not talked about enough. And you feel that as a queer person, like, you know that like in your bones.
Are you describing like a sort of pushing away by the therapist, a sort of
Yeah, like
holding
you're
you
over
back?
there, like you're over there as the gay client, and I'm over here as a straight male, very secure in my identity, and it's fixed.
And my identity that's privileged by society and is very comfortable, and I'm centrally socially located, and you're
not so much.
different, and we'll try and help you work through that. Or
Yeah.
they're coming from another power imbalance as well, isn't it?
Big one, that one, particularly because I find I see majority of clients I see are gay queer men, and often they've been bullied by straight boys. Well, straight boys, like just boys at school. So that's often unprocessed, living in the body, and you sense it. Like you're always, and that's the thing about living a queer life, is you're always, even in places like Melbourne, like the inner north, you're still looking out for safety and you're vigilant. So that's part of you is going to be in the therapy room too.
It really touches on shame, doesn't it? And your work with shame with queer people, that they're needing to find that safety, and that in a society that's so heteronormative, that in itself is shame inducing. The fact that our society is so patriarchal and hetero.
Right. And there's more instances of homophobic violence happening like now with the whole lean to the right. And so it's alive. Like even if you've worked through like a bunch of your own stuff, new stuff just can happen, like obviously. And your like shame doesn't go away completely. Like we need it, like as humans. Like,
Can you say more about
well, I think, what is it Brené Brown says? If you don't have shame, you're a sociopath. So ideally, you're not a sociopath, and like you can, because it's function being around belonging and being in a community. So if I do something that causes me to be cast out, my survival is at risk. That's less so like a literal problem now because we have access to our own resources, but that's deeply in us. Like we are a collective species, and so that's why it is the master. They talk about the master emotion because it's so linked to survival. And
are you saying the function of shame is to keep us connected and belonging?
Well, it's to regulate the rules. So if I do something that's against the community rules, right, then I guess maybe in the past that would have been dealt with by exile.
And potential death from being exiled.
Right, because you could be eaten by a predator. So it's function. We do need to have shame. It's just the level of it. Like, so when I work with clients and they're in a critic, which is the thought-based manifestation of shame, it's like, we're not going to get rid of this part of you because you need it, but we need to turn the volume down and the intensity down. You don't need to have it on like 100% volume all the time anymore.
This is one of my favourite topics because I think we spend, and a lot of therapists do this too, we spend a lot of time trying to get rid of the inner critic or tell it to shut up or fuck off or whatever.
Right.
What's your theory around that?
Yeah, I have experienced both. Sometimes you do have to be pretty more forceful, say, with that inner critic part to get you some psychological space. But I feel like that's a bit later on. So to begin with, it's like identifying you even have an inner critic, that you have bodily shame that comes with it. And you're initially, and I've got a free guided meditation on my website for this, you're initially just trying to develop a relationship with that part of you so you can notice it coming up, you can negotiate with it. So often I'm talking to clients about, how do you ask that part for a bit of space? We're not going to get it to we're not going to vanquish it, because it's just, I think the risk of that, particularly in early stages, which is maybe what you're getting at, is it will come back with like twice as much force when you're sick or vulnerable or you've been rejected by someone. So yes, developing like a kind of collaborative relationship and developing at the same time in a compassionate voice. So for me, when I've made a mistake, and often that's around like disorganization, because that's like a big like theme for me, like a shame kind of code, if you like, have that like, you idiot, like that inner critic voice come in. But then at the same time, I'll have the more compassionate voice that will come in and it'll be like, it's not a big deal. Like, we can be late 5 minutes. Like, no one's going to care.
Yeah.
Yeah.
Can kind of balance it out a little bit. And are you describing that under the inner critic is shame, or that the inner critic comes from our shame?
I'm not sure. To me, they feel like the same thing in a way. Like, there's like the thought, the inner critic being like a part of the psyche that's often thought-based, that lives in our heads and speaks to us. And some people think that is their inner voice. Like, that's the only inner voice they have. So that's worth noting, because it's not. And then
just the most dominant.
Just the most dominant, taking up the most space. And then the shame in the body, I think they can present independently and together. But shame in the body is felt usually very viscerally. Is that answering the question?
Yeah.
Yeah.
Yeah. So you describe the inner critic, I think you said before, the cognitive or thought manifestation of shame. That's how it appears in our mind.
And some people who have pretty big imaginations, they have like a name, a character, they can personify it, which is really helpful, because if you can personify it's like, have you watched Big Mouth? It's like, anyway, there's a shame wizard on it. And he's this creep, right? And he's always in a cloak and he just kind of hovers off the ground and says gross things to these poor teenagers as they're growing up. So I've kind of adapted that image in my head of mine, and I'm like, oh, get away, you creep, like, stop saying that stuff. So if you have a good imagination, you can do that to like externalize and get some space. And for some people, it's just very concrete, like it's just more just the voice, or maybe they don't have the voice and they have the feeling, but you can still work with that.
Yeah. And for me, in my critic that I've actually got quite a good relationship with these days, but the embodied feeling of shame, it's a really difficult one to feel, right? Like I'd rather feel any other feeling pretty much than to sit with my shame. And I do, because I know it's necessary and I know it is healing, but it's so hard to sit with. And I guess that's why our internal system develops ways to keep us away from our shame. Like, what do we do to keep away from our shame?
Drugs and alcohol.
Yeah.
Like sex. I often talk to clients about the inner critic, and this is from Parts work and internal family systems. So the inner critic, inner indulger dynamic. So I got sober back in 2021, but before that, I would be in this cycle with my inner critic and inner indulger where I was working full time and I was, being somewhat kind of slammed by the inner critic during the week. And then there'd be this changeover on Friday and I'd be like, wow, I'm really excited about like going to this party or whatever. But it was like this anxious excitement. And I think what I've realized is it's like this changeover is happening in me. It's like the inner indulger's coming in to relieve the stress in the system that's built up from the inner critic. And it's like, fuck it, I'm going to do what I want. And I will have as many drinks as I want. And there's going to be low limits. And it's like pleasure seeking. It's all about that instant gratification. It's not really thinking about the consequences. And then usually what happens is you wake up the next morning, you feel hungover, maybe you did something you regret. And then the inner critic kicks in again and you're back in that cycle, right? You're Sunday, you kind of pull yourself back together, trying to get ready for the week. And then it keeps repeating like that.
It's almost like they're two parts. Well, like you're describing, they are two parts of the system that are trying to compensate for one another. So the inner critic on Sunday morning and for the rest of the week is trying to compensate for what a dickhead you were on the weekend.
Right.
And then come Friday, the inner indulger is like, okay, we've had a hard week with the inner critic. Let's set ourselves free.
And we do need that. We do need relief. We do need rest. We do need connection. And we do need play. And unfortunately, and this is a big issue in the queer community because there aren't enough places to connect and be playful outside of sex and alcohol and drugs. So yeah, they're both important. They both protect. In internal family systems, they talk about being protector parts and exiles, and the inner critic and inner indulger are protector parts. They're trying to keep the exiles, and exiles are usually younger parts of us that hold trauma from the past out of consciousness and keep us functioning, right? Like you need to do your job. You need to respond to those emails and keep your boss happy and pay the bills. Like they're all real responsibilities.
And we can't walk around with that wounded inner child when we're at work. Like it's got to be.
Ideally not, no.
It's either got to be unburdened and integrated, which is the work of psychotherapy or the work of IFS, or it's got to be locked in the basement where it can't get out, right?
Right.
So those protectors make sure, the inner critic makes sure that we don't go near the shame.
Right.
By maybe being perfect or never stuffing up. The inner indulger tries to counteract what the inner critic's done. And the exile or inner child stays locked. It's generally how we're all functioning, right?
Mm-hmm.
Yeah.
That makes you think of intersectionality in terms of how loud your inner critic tends to be or how much shame you're carrying around. So in my experience, in my practice, the more intersections of minorities or that you're existing within, the more shame you're carrying around. And because the shame comes from the outside and gets brought in. So it's a problem out there, and because of racism and transphobia, homophobia, and misogyny, those things get internalized, and the more of it we carry around inside of us. And I guess that means, I'm not sure if that connects to this point, but the less safe it feels maybe to like let those wounded parts up. And
'cause who out there can hold it in a racist, misogynistic, queerphobic, transphobic society? And like you described before, shame threatens our connection with others. So, okay, I've got this part that others seem, the majority don't have or might reject, so I'll lock that away. And then we end up with all of these parts of us locked away that we can't show people in case we're exiled. And that's in our nervous system.
Yeah.
And then the amount of effort those protectors have to go to on a daily basis to keep all of that locked up and keep outwardly functioning in an unsupportive society.
It's a lot. It's
exhausting.
It's a lot. And makes you think of grief.
Yeah.
Which is common when you contact parts of yourself that have been locked away. You're like, fuck, like it's been 5 years or whatever it's been that you've thought about it. Let yourself think about that part of yourself. And that can be quite shocking, I think, for clients in the room. I think about it as a kind of self-betrayal and self-abandonment.
Yeah. There's this constant choice we're making, right, between belonging and authenticity. And the nervous system and just generally we are wired to choose belonging over authenticity.
Yes.
And when we do that, it's a self-betrayal.
Right. And then and Brené Brown talks about this, like I would argue that your level of belonging can only works in parallel to your level of authenticity with yourself, because you will know, like on some level, that you've locked away these parts and you can't show them to your close people. And it means there's only a certain amount of closeness you can have with others.
So are you saying you might belong on the outside, you might appear to belong and have some sense of safety in that?
Yeah.
But you can't truly belong if you can't be authentic.
Well, maybe it's like a spectrum, right? Like it's not either or, but it's like, well, there's levels of belonging you can have depending on how much you've been able to own your story and those different parts of you. And I find that in my experience, both personally and with clients, is that you tend to like spend time with and attract people who are at a relative stage of development to you. Does that make sense? So if you're hanging out with a bunch of people who find it really hard to go near their shame, for instance.
Like when everyone had their like party era where, your friends were all just party friends. And that's like a stage where you're potentially having that kind of surface level connection of we just all avoid our shame together every weekend, and that's our relationship.
And there can be a joke about that, right? And that can be funny, but also tragic. Because as you get older, I think the more you become aware of your need for more depth in connection.
Yeah. And not to say that anyone who's partying is necessarily doing that, but that was definitely my experience in my 20s and like quite early 30s. I was just like, I'm going to go out on the weekend and have heaps of drinks and have the best time. And it wasn't until I stopped drinking that I was like, oh, wow, there's some stuff here that I haven't been acknowledging even to myself or haven't been able to share.
Yeah, and it always just comes back annoyingly.
Yeah.
To just waiting there. I got depressed for like 6 months after I stopped drinking. I was like, And so much stuff I had to deal with. It was, the equivalent of like just a messy house inside that I had to spend a lot of time with, and it was really hard.
Yeah.
Yeah.
Things aren't compartmentalized. I remember thinking after I stopped drinking, God, it's so boring. It kind of is. But what I think was actually feeling was there's some stuff here I don't want to sit with and I want distraction. And I translate that to I'm bored. But without alcohol, it felt boring. Without alcohol, I was like, where's my distraction? It's not that I even drank every day. It was only weekends, but I looked forward to that. I knew my distraction was coming Friday night.
It gets you through.
Yeah.
Yeah. Well, the emptiness that comes when you stop is a big part of it. And that's a part of human experience too, and has its role, and not an easy bit to move through. Yeah, particularly if you don't have a lot of support. Like maybe you're the first person who's made that kind of decision in your group of friends, or you have no role models, right?
Yeah, and judgment even from people.
Yes.
Yeah, lots of why are you doing that? I think it held a mirror up to some people, and they were not happy when I stopped drinking.
Yeah, that gets very tricky, doesn't it?
Yeah,
friendships.
Yeah. Although I must say, every friendship evolved. None of them fell away. They had to evolve or fall away, and they all evolved.
Yeah, that wasn't I definitely had some fall away.
Yeah, right.
Yeah, because I think certain friendships were so embedded in that world, and that's how we, connected and had deeper meaningfuls, and that was really hard. There's a lot of grief about that at the time.
Yeah. It makes me think of it, that alcohol or whatever was sort of a gateway to a more authentic connection that you couldn't have without it.
Yeah.
Yeah.
But then you don't remember it.
Yeah.
Or you do remember it, like you remember bits of it.
And then feel ashamed about oversharing because you were drunk or
oh yes, floodlighting. We haven't talked about that.
No, say about that.
Okay. I was referencing a lot of Brené Brown today. Floodlighting, as defined by her, would be when and everyone's had this experience, I know I have, is when you share too much and the relationship can't hold it. So it's like the equivalent of putting your floodlights on someone else, when you're driving and the high beams are on and you can't see. And the other person gives you this looks like rejecting response, but they're just shocked usually, or don't know how to respond because there's not enough intimacy in the relationship. And that happens a lot when you're drinking because you're disinhibited, right? We all want to share. And unfortunately, what that does is if you perceive a rejecting response, you go into more shame. And then the story or that thing, that part gets pushed away again for a period of time.
Yeah. So, it gets locked even deeper down in the basement with an extra layer of rejection, self-rejection, external rejection.
And I tried to tell someone, and I'm right, it's gross.
And this can happen in therapy, right? It's not just with friends when you've had too much to drink. If you share something with a therapist and they can't hold it, and you get, a microsecond of like a flash across the therapist's face that they're like, oh, yeah.
We're very tuned to that stuff when you were sharing something like that.
Yeah.
You feel it in the room, like everything. It feels like in a moment, like time stops, like they're really looking, everything is being noticed. And I know that as a therapist, you're like, I've got it. I'm going to try my best to get this right and not be empathic and non-judgmental.
Essentially the client has exposed something that they've not been able to bring anywhere else, and that we need to help them hold it.
And get through that moment of the telling. Often that's the hardest bit.
And so often, hopefully most of the time the therapist does a good enough job of holding it. And I think this is a bit of a generalisation, but maybe the more experienced a therapist is, sometimes people share things that they think are going to be really difficult for me to hear from them or hold, and it's really not. You know, it's
for you in
for
particular.
me as the therapist.
Yeah.
You know, it's totally fine for me to hear that and hold that and be with them in it, but they're expecting that it's not going to be, and with good reason, because it has been rejected by other people for so long and could be rejected by a therapist in some way.
Yeah. It makes me think of our own individual, like, shame triggers. So what you feel shame around is different to what I feel shame around. And that comes up relationally in the therapist-client relationship. And you're not going to know that. Like, it's not like a therapist is going to have on the website, like, these are my shame vulnerabilities. Might be helpful. Yeah. And we stumble across them, and it can be really messy. And hopefully you can do some rupture and repair work with clients on that.
Say a little about rupture and repair for people who don't know.
So that's when maybe there's been something that's happened in the therapeutic relationship where there's hurt feelings, for instance, like you felt misheard or judged by your therapist. And so,
or you shared your shame and that you saw them not able to quite hold it.
Right, yeah. And ideally, you can talk about it. So I guess a rupture and repair process would be acknowledging that there's been some kind of rupture in that connection, and the therapist being able to talk about their part, what they said, or be able to notice how they contributed, and speak to the client about what that brings up in them.
That curiosity.
Right.
Rather than defensiveness. Yeah.
And then be able to do the reparative bit, I guess, and it's not that complicated sometimes. It's like you can give a heartfelt apology, not labour on it, and move on.
And that process, we tend to think that we shouldn't have to do that, but therapy's relational work. There are going to be times where you, as a therapist, kind of get it wrong or miss the client, or there's some miscommunication. Being able to have that conversation, or the therapist noticing, it doesn't have to be the client that brings it up, right? The therapist can say, I feel like I kind of missed you there. What's happening for you? And inquire into it. And if you can have that conversation, that creates a level of safety that wasn't there before. It actually deepens the relationship.
That is a good point.
Because you know that the therapist and that the relationship is capable of being with something tough.
I think of that as like scar tissue, because I'm just very visual, but the you know how like scar tissue is generally a different type of skin. Feels like it's tough. I don't know if it actually is tougher, but it speaks to that. I think that you feel like if there's been a rupture and repair that's gone, good enough, like it doesn't have to be perfect. That I know that if I was the client, that I can get it wrong. The therapist can get it wrong. We can talk about it in the moment. Doesn't necessarily have to be a big deal. And then, trust builds with that. Like it feels solid. Like you're like, this is a solid relationship. Like maybe I can share a bit more of myself.
Yeah, we can have tricky conversations and move through it. So moving into our segment of therapy, obviously this is going to be a really short section of what therapeutic work can look like. And it's quite different to usual therapy with cameras, the recording, with people listening, potentially. So I guess I just want to acknowledge the ways in which it's different for you as a therapist to do this in this context because of those things, and that the privacy that is so important for therapy comes at the cost of people having a really good understanding of what therapy can look like and can feel like. So that is the reason why we're doing this little segment, to demystify it a little bit, actually show people a piece of therapy. So I am going to be talking about real stuff. Some of the ways that it's also different to, I guess, like therapy that a client might do is that I am a therapist, so there's a certain amount of like security in this for me. I've also done 20 years of therapy, so I'm not too worried about what's going to come up for me and how to moderate that if I need to. And also I have ownership over the recording, and so in those ways it's quite safe for me. But let's change our roles a little bit here, and I'm going to sit here in this chair as your client, and I guess I'll hand over to you.
Sure. What feels important to talk about?
It's interesting sitting with, as we've been talking about, the inner critic and shame and the connection between them. In some parts of my life, my inner critic is quite strong, and I think it comes out as perfectionism. And it's largely in my parenting. And I can feel that there's a connection in there to shame under that perfectionism.
Are you saying that that's where it's showing up in parenting?
Yeah.
Can you give me some examples? Or one example that's recent?
Yeah, I think I have an expectation that being a therapist, that I will be a perfect mother. And there's a part of me that smiles as I say that, like, lol. There's a part of me that actually believes that.
There's like, you're doing that with your hand, like on the angle, like, do you know what that is?
I think it's like there's a part over here saying no one's a perfect mother, and there's a part over here that's like you should be.
But it's like, if I do that with my hand, it's like a pressure,
Oh my God.
like being slammed with that expectation.
It actually feels, as you name that, it actually feels like I am not only like laying down the law about how I should be as a mother. So there's a very stern part, very stern inner critic about this is how you should be. But at the same time, I'm like pushing something down. Like,
what do you think that could be?
I don't know, but I've got like a sick sort of feeling. I don't know why I'm laughing at that, but yeah.
Okay, so it's the stomach coming up, something.
Yeah, it's actually, I feel like I've got a bit of a bad taste in my mouth, actually. So it's sort of a sick feeling, and then, something yuck.
Okay, so if I invite you to like maybe your hand where you feel it, is it, there?
It sort of feels like maybe it lives down here, but I'm feeling it more, moving up into my mouth.
So if you just breathe into that sensation from just a few breaths.
It's so bitter. It's like bile.
Mm-hmm. And you're just letting it know that you notice it, whatever that is, that sensation. You don't need to interpret it or judge it.
Actually, I feel sad.
Mm-hmm. So let that sadness know you notice it too. There's a bitterness, there's a sadness.
Yeah. I'm getting like an image in my mind of like a younger me that feels wrong. Like a 5-year-old.
A young.
Oh, the reason I'm sighing like that because this is the age of my child, my current daughter, and I've felt like this since she was about 3. So that it's like a 3 to 5-year-old that I'm seeing, and this is how I've kind of felt this pressure and how I should be as a mother for like the last 2 years.
So you're saying that there's part that's the kind of inner critic part that's being hard on the part that is around 5 that feels wrong.
Yeah.
Yeah. So just breathe into that might be a dynamic that's going on inside.
Yeah.
You don't need to try and fix it, particularly not on a podcast in 5 minutes, but just acknowledge it. Like there's a kind of bit of a dynamic with this pressure and has some shame in it. Yeah. And then there's the more vulnerable bit.
I feel a real gentleness towards myself, like just with this awareness that, I've got this critical part and underneath there's this vulnerable part.
Right.
Like I feel myself soften a bit to even just know that.
And it makes sense that it correlates with how old your daughter is.
Every age she has been, that part of me has been triggered. when I was breastfeeding, the baby in me that wasn't breastfed was triggered. Like every age that she has been, oh my, parenting is undoing me. This is a whole other podcast.
Yeah. Okay.
But it's so shame-based. And then there's external things like being a single mother, of internalising that patriarchal stuff as well. That's part of you got to be the best single mother there ever was to make up for what society tells you is a deficit.
Yes. You know? Yeah. It's a lot.
Yeah.
A lot of pressure.
Yeah, I just feel, the word that just keeps coming to my mind is I feel more gentle. I feel this, even my hand, I don't feel like being as like, it's more like.
Gently slamming.
Just a gentle pressure. No. Yeah, it's not. That doesn't feel like the movement now. It's a more soft, even like that maybe. Yeah. It feels really nice.
Great.
Maybe we can leave it.
Yeah.
I'd love to chat about what kind of came up and how you guided that exploration. And I also want to name that was a pretty fast, and again, because I'm a therapist and all of that, that was that might normally take longer, right?
Right.
Yeah.
Probably a lot longer. What was going on in my kind of head watching?
I mean, the intervention of noticing what I was doing. I wasn't aware of what I was doing with my hands. So that intervention of noticing that I was doing that, like that was so powerful.
That feels like it's very Gestalt. That comes from that. But I think also that's because I'm an artist and the visual is, I think one of the reasons I was drawn to Gestalt was the focus on the body and body language. And we reveal like a lot, right? What we're feeling with our bodies that we maybe don't, or are always aware of.
Yeah, and the fact that I didn't know, I paid no attention to what I was doing with my hands as I was speaking, but that's kind of the power of having someone there with you, right? That you observed that, drew my attention to it, and it really took us somewhere.
Right, and then you also had a kind of, you did something with your mouth, which was like a pursed, disgusted, like, and it's really common, like the kind of, it's almost like it feels adjacent to hatred. Like you said the bitterness,
I think I might have even said yuck, or at least I thought.
Yeah, that sounds like a bitterness in the mouth. And I noticed that as well with the pushing. And the more you noticed it, like when I got you to sense into it, I think that was about bringing presence to the sensation. And that's often the thing that will transform it, just us noticing it. Something else can come up. Not always, obviously. That's a very quick, you have access to that very quickly, that compassionate quality. That's the inner compassionate voice we talked about before.
Right.
It was there for you straight away, pretty much alongside the pressure, the bitterness, the inner critic.
It never ceases to amaze me how just being with a feeling helps loosen it somehow. So, the inclination is no one wants to feel that yuck that was coming up, right? Inclination is to push it down, eat or drink something, get rid of it.
Yeah. And I think it takes a lot longer than we think. Do you find that? It just takes, I think when you're supported by someone, that process is faster. But when you're doing it on your own, and that's the reality, that's probably when shame is going to come up. You're going to be with that. It takes a lot of attention and practice and being with, got to really make space for it.
And build the capacity for it and build the safety for it. And we also have a certain amount of safety in that I know I've done some of the same training as you. I know your training. I know you personally. That creates.
There's all the ground for you to be able to do that.
Yeah, in a first 5 minutes of a therapy session with a new therapist, that's not going to be accessible, right?
Sometimes not really. If someone came in with a lot of insight and readiness to talk about that topic, and they were like, "Yes, this is the thing. I want to talk about my relationship to being a mum and perfectionism." Then maybe, yeah.
I guess if they had a certain amount of safety within themselves, so they didn't need to know so much that you were going to, hold it. They had enough trust in themselves that they didn't need to know that they could completely trust you first. Or
right, and like you said before, like the how much you can pull it back. I think you said that, like that you have a sense of like, I know how to unwrap. I know how to rein this back in if this doesn't feel safe. Or
which some clients might not feel like.
It's really hard, and particularly when you're in the therapy space, like there's this expectation, right? Like you should just talk about everything, but it's all. We think of questions around consent and like trusting your body, and like actually maybe the most respectful thing to your system is to rein it in.
It's so interesting because we talked a little earlier about maybe the times where therapists can be too passive and it's not in service of the client. But there's also the opposite end of the spectrum, right?
Catharsis.
Yeah.
Yes, and I think that, well, you're not saying, but like, yes, too direct, too like, egocentric, and
it shouldn't be forceful, right?
Not around that stuff, I don't think. Of course, there's going to be times when you need to be direct and a bit blunt, and I'm certainly known for that at times. But
sometimes there's stuff that's hard to hear that you actually got to hear.
But I think initially with shame, you got to make the space safe enough for people to even talk about it and feel it in their bodies. And that they can learn to rein it back in, because there can often be this feeling like if I finally let myself feel this, I'm going to be flooded.
I won't be able to package it back up again and go to work or...
Right. And so I find there can be a lot of value in teaching clients that kind of pressure valve stuff. So like, can you feel 10% of it? Okay, we're going to feel this for 5 minutes and then you're going to pack it up.
Yeah, and I'll show you how to.
Yeah, people usually know how to do that, and you can help them. Because sometimes you'll need, like I'm thinking about like work, like maybe of course shame's going to come up at work. It might be really supportive for you to go to the bathroom and just be with it 5 minutes. You know that you need to be like in a meeting in 10 minutes, and that's just the time you have. So you kind of give it that much space. Yeah.
Thank you so much, Matthew.
Thank you
for coming on.
Yeah, it was really lovely to talk in this form.
Yeah. If this conversation resonated with you, hit subscribe and click the link below to download the Source app. It's free to get started and helps you find a therapist who truly fits fast.